Thousands of you received your first injection today. Others are scheduled for tomorrow. There's a chance you could experience mild symptoms like headaches, chills, or arm soreness. Before you reach for a painkiller, watch this from Channel 5's Marisol Villarreal.
There isn't enough research that shows taking over-the-counter medications before or after you take a COVID-19 vaccine can lead to severe symptoms. But one medical professional that I spoke to says if you're experiencing mild symptoms, it's best to not take any medications at all.
In this case, when you get the vaccine, you want the inflammation to go as high as possible because that elicits a response. If you give a drug to block that response, you could be shortchanging your response.
Chief Medical Officer of DHR Health, Dr. Robert Martinez, explains anti-inflammatory medications like aspirin or ibuprofen could potentially make the vaccine less effective if taken before or after getting a dose.
Theoretically, that could happen. I think we don't know enough right now. A lot of these things are minor aches and pains that are going to go away. Certainly, they should not be prolonged more than a few hours or half a day or something. So they're saying if you could stick it out, it's probably better to stick it out.
Dr. Martinez says so far they have not seen any cases of severe reactions to COVID-19 vaccines from their vaccination clinics or hospital patients. The only known side effects are arm soreness, headaches, and chills. But he adds if you've received a COVID-19 vaccine and the pain is a nuisance or unbearable, there are safer alternatives.
There's pain medication that's not anti-inflammatory, and that is Tylenol. Tylenol is more of an antipyretic, completely different mechanism of action, which will lower a fever and is a pain reliever, but won't necessarily affect your immune system by anti-inflammatory pathways.
Dr. Martinez adds if vaccine symptoms last longer than a day and a half, or if you have questions about how the vaccine reacts to certain medications, check in with your primary care physician. Marisol Villarreal, Channel 5 News.